Narayana Health reinforces commitment to building India's future healthcare workforce through Udaan. Yes, my dear friends, Narayana Health today announced the continued expansion and impact of its Udaan Institute, a long-term program designed to strengthen India's healthcare workforce by enabling meritorious students from economically modest background to access medical, nursing and paramedical education in government institutions. Through structured guidance and financial support, the institute help students secure seats in government colleges and possess sustainable career in healthcare, contributing directly to strengthening India's healthcare ecosystem and improving the country's doctor to population ratio over the long term. As a part of the institute, Dr. Devi Shetty, founder and chairman, Narayana Health, today felicitated Udaan-supported students who are progressing into government medical and nursing career, highlighting the program growth impact. Over 12 years, Udaan has enabled to 1,200 plus MBBS students and 800 plus nursing students from undeserved backgrounds to enter India's healthcare system. Program outcomes include 36 AIIMS admission and 360 plus students joining government medical college in the last
ಇದು ಈ
years.
ವರ್ಷ 204 ಮೆಡಿಕಲ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ನಮ್ಮ ದೇಶದಲ್ಲಿ ಗವರ್ಮೆಂಟ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಸೀಟ್ ಸಿಕ್ಕಿದೆ. ಅವರನ್ನೆಲ್ಲ ಅದು ಸೀಟ್ ಸಿಕ್ಲಿಕ್ಕೆ ನಾವು ಉದಾನ್ ಪ್ರೋಗ್ರಾಮ್ ಅಂತ ಲಾಂಚ್ ಮಾಡಿದ್ದೆ 15 ವರ್ಷದ ಹಿಂದೆ. ಈ ಮಕ್ಕಳಿಗೆ ಪ್ರೈವೇಟ್ ಟ್ಯೂಷನ್ ಇಲ್ದಿದ್ರೆ, ಟ್ಯೂಟರಿಂಗ್ ಮಾಡದಿದ್ರೆ ನೀಟ್ ಎಕ್ಸಾಮಲ್ಲಿ ಪಾಸ್ ಆಗಿ ಗವರ್ಮೆಂಟ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜಿಗೆ ಸೀಟ್ ಸಿಗೋದು ಅಂತೇಳಿ ಕಷ್ಟ ಇದೆ. ಅದಕ್ಕಾಗಿ ನಾವು ಆ ಉದಾನ್ ಪ್ರೋಗ್ರಾಮಲ್ಲಿ ಅವ್ರದ್ದು ಟ್ರೈನಿಂಗ್ ಪ್ರೋಗ್ರಾಮನ್ನು ಸ್ಪಾನ್ಸರ್ ಮಾಡಿ ಈ ಮಕ್ಕಳೆಲ್ಲ 204 ಮಕ್ಕಳು ನಮ್ಮ ಬೇರೆ ಬೇರೆ ಜಾಗದಲ್ಲಿ ಇಂಡಿಯಾದಲ್ಲಿ ಗವರ್ಮೆಂಟ್ ಮೆಡಿಕಲ್ ಸೀಟ್ ಇಟ್ಕೊಂಡು ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ. ಗವರ್ಮೆಂಟ್ ಸೀಟ್ ಯಾಕೆ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತ ಹೇಳಿದ್ರೆ ಫೀಸ್ ಭಾರಿ ಕಡಿಮೆ ಇದೆ. ಆಮೇಲೆ 34 ಮಕ್ಕಳು ಏಮ್ಸಿಗೆ ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ. ಇದೆಲ್ಲ ಆಯಿತು. ಬರೀ ನಾವು ಖರ್ಚು ಮಾಡಿದಂತ ಹೇಳಿದರೆ ಒಂದೊಂದು ಸ್ಟೂಡೆಂಟಿಗೆ ಬರೀ 50,000 ರೂಪೀಸ್ ಖರ್ಚು ಮಾಡಿದ್ದೇವೆ. ಆದರೆ ಅವರು ಇನ್ ಟರ್ನ್ ಗವರ್ಮೆಂಟ್ ಮೆಡಿಕಲ್ ಸೀಟ್ ಸಿಕ್ಕಿ ಮುಂದಕ್ಕೆ ಔಟ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಡಾಕ್ಟರ್ಸ್ ಆಗುವ ಚಾನ್ಸಸ್ ಇಸ್ ವೆರಿ ಹೈ.
ಈ ಯೋಜನೆಗೆ ಏನಾದರೂ
ನಾವೆಲ್ಲ ಯಾವಾಗಲೂ ಸರ್ಕಾರದ ಮೇಲೇನೆ ಕಾಯ್ತಾ ಇರುವ ಅಗತ್ಯ ಇಲ್ಲ. ನಮ್ಮ ದೇಶದಲ್ಲಿ ಎಷ್ಟು ಜನ ಶ್ರೀಮಂತರಿದ್ದಾರೆ, ಅವರಿಗೆ ಬರೇ ಒಂದು 50,000 ರೂಪಾಯಿ ಸ್ಪೆಂಡ್ ಮಾಡಿದ್ರೆ ಒಂದು ಹುಡುಗನ ಒಂದು ಹುಡುಗಿಯನ್ನ ಗವರ್ಮೆಂಟ್ ಮೆಡಿಕಲ್ ಸೀಟ್ ಸಿಕ್ಕಿದ್ರೆ ಅವರು ಔಟ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಡಾಕ್ಟರ್ಸ್ ಅಕ್ರಾಸ್ ದ ವರ್ಲ್ಡ್ ವಿತ್ ಮ್ಯಾಜಿಕ್ ಇನ್ ದೇರ್ ಫಿಂಗರ್ಸ್. ದೇ ಕಮ್ ಫ್ರಮ್ ದ ಡಿಪ್ರೈವ್ಡ್ ಬ್ಯಾಕ್ ಗ್ರೌಂಡ್. ಸೊ ನಮ್ಮ ದೇಶಕ್ಕೆ ನಾವೆಲ್ಲ ಮುದುಕರಾದಾಗ ಒಳ್ಳೆ ಡಾಕ್ಟರ್ ಬೇಕಿದ್ರೆ ನಾವು ಈಗ ನಮ್ಮ ಸಣ್ಣ ಮಕ್ಕಳ ಮೇಲೆ ಇನ್ವೆಸ್ಟ್ ಮಾಡಿ ಅವರನ್ನ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಸೇರಿಸ್ಕೊಂಡು ಒಳ್ಳೆ ಡಾಕ್ಟರ್ ಆಗಿ ಮಾಡಬೇಕು. ಆಗ ನಾವು ನಮ್ಮ ಓಲ್ಡ್ ಏಜ್ ಅಲ್ಲಿ ಅವ್ರು ನಮ್ಮನ್ನು ನೋಡಿಕೊಳ್ತಾರೆ.
And I needed to go through the coaching. Without coaching, it is very difficult to crack these exams. There is a code you have to follow, which only the proper coaching can provide. But these are pretty expensive for children coming from lower socioeconomic strata. In the process, medical education in India has become an elitist affair. If we don't go out of the way to train children to crack the NEET exam, children from working class and poor families, they will not stand a chance to compete with the children with all the resources who have the access to all this sophisticated training program. Now, why it is important that children from lower socio-economic strata should become doctors? This is vitally important for the national security. In my observation, outstanding doctors across the world with magic in their fingers generally come from the deprived background, because these are the children with the fire in the belly and they are willing to work 16, 18 hours to learn the art of healing. Medical profession is one profession where you cannot look at work-life balance. Today in every profession, people do talk about work-life balance. Fair enough, that's okay. But when one decides to become a doctor, we can't say that I need to have a good night's sleep so that I can have a pleasant day next day. No, you have no idea what time you'll be called. I'm sure you haven't forgotten the days of COVID. When COVID just came, nobody knew how fatal the disease was. Every doctor, every nurse working in the country, they had no idea that if they get COVID, whether they're going to survive or not. But still, all the doctors, all the nurses went forward and treated the patient as a duty. This is the sacrifice what is important for the future generation of the doctors, because there will be several challenges. So the whole purpose of creating this program is to set a precedent for the others to follow. It only costs 50,000 rupees to support a young student to crack the NEET exam. Now, we just need 50,000 families of India coming from wealthy background to support one student or two students, which is not a lot per year. Then we will be able to get 50,000 students every year supported by these programs to enter into a government medical college. I just want all of you to know that getting into institution like AIIMS is one of the most complex things one can achieve. If I calculate all my marks from first standard to the 12th standard and multiply by 100, still I will not get into AIIMS. This is how complex these exams are. I want to congratulate all of you that you all have successfully entered the medical college. I have some word of advice, a few words of advice about the future. One day you will become a graduate with a degree called doctor, and that will be the happiest day of your life. Then the real exam starts. The real exam is not the NEET or the MBBS, first MBBS, second MBBS. That I know all of you will pass. Now, how do you pass the exam of life? To do that, what matters is how many hours you have spent your precious time on the bedside. How much time you have spent talking to the patient, understanding their problem, and treat them with dignity and empathy. And that is what will make you an outstanding doctor. No patient of yours will ever ask for your marks card or how much marks you scored in the exam. They will look at your face and look at the empathy, and then they will agree to do whatever you want. As a doctor, when you tell the patient that I'm going to do this operation, there is a possibility he can die from the operation. And they take the decision to undergo the procedure in less than 5 minutes. A decision which can decide about their life and death. That decision they will take only by the way you have spoken to them and you have dealt with them. This is the art which you all have to learn from day one. And that is what will make you an outstanding doctor. Once again, I am extremely grateful to all of you for giving me the opportunity to be of some assistance in your future building, career building exercise. But one day, when you become a successful doctor, driving your most expensive sports car or living in a very luxurious house, always try to pass on what you got so that lot more children will be benefited by your generosity. Thank you so much for the opportunity.
There was always a competition. Don't look at other people. You just, so the only thing what you have to do is to keep